Assalamu alaikum. My name is Bushra. On behalf of the ICJC Women's Committee, I would like to welcome you all this evening to our second talk on the topic of COVID-19. We thought now would be the perfect time to revisit the topic as we have learned new things about the novel coronavirus, as well as shed light on the upcoming flu season right around the corner. Our panel tonight includes Dr. Sophia Khan, Dr. Asad Kabir, and Dr. Maniza Itisham. They will be able to give us insight on what is happening here in our community as well as nationally. We have gathered some questions to address for each of the panelists. During our talk, if at any time you have additional questions, you may please submit them in the Zoom chat box or on YouTube or Facebook Live in the comment sections. All of our panelists this evening are busy professionals who have worked today, doing hospital rounds, or are on call. They have taken the time out of their day to address this very important topic, so please give them your full attention. So let's begin, inshallah, with Dr. Sophia Khan, our first speaker. The first question that we're going to address is COVID versus flu, the similarities and differences in symptoms, onset, and course.
Okay, so to tell you a little bit about how in the beginning when COVID was starting, and I'm sure Maniza and Asad might have been through similar ordeals where we had not openly recognized that COVID was in our community. And we were all almost calling it a flu type symptom for patients who are negative for flu. This is how similar the two conditions felt. People would come in with body aches, fever, shortness of breath, their oxygen level was dropping, but they were negative for flu. So what I'm trying to say is the two conditions are very similar to each other in the initial presentation. And if we were not thinking about COVID, we were perplexed between what the condition was. So it's the same thing is going to happen. Body aches, fever, even nausea, vomiting, diarrhea, which is a GI symptoms along with respiratory symptoms, is considered pretty classic for the influenza virus, And it is also pretty common in COVID. Obviously, COVID is a much deadlier and much serious condition, which multiple other symptoms also happening. You know, there's a much higher risk of blood clots in COVID-19. But for a common person, other than the very complicated cases where we have seen heart attacks, we have seen stroke, we have seen other serious conditions come up, like their sense of smell goes away, their sense of taste goes away. We are now part of it, hearing loss is happening. So those into the flu. That's why it's very important for you to get tested right away, both for flu and for COVID, because they will have very similar presentation. So for common person, I think it's just, you need to remember that if you have fever, chills, nausea, vomiting, with respiratory symptoms, trouble breathing, body aches, it's best to get tested for both. But until you get tested, you need to, for both diseases, they are both very contagious. So either way, as soon as you start having these symptoms, try to figure out a way to get tested right away. During the winter season, it's going to be both for flu and for the coronavirus.
Okay, so the next question is, or I should say a misconception is, if I take the flu shot, I get the flu. Could you please discuss that?
So yes, I hear that from our patients, and sometimes even our nurses and stuff say, oh, I can't take flu because if I get the vaccine, I get the flu. This is not true. The vaccine does not give the infection. But we have to recognize that when we take the flu vaccine, or before the flu vaccine is created, you know, the scientists that create it, they kind of do a little bit of guesstimate of what strains of flu might be coming that year. And based on that, they create the vaccine. And it's a hit and miss. As physicians, we know that there are some years when the vaccine works really well. and we don't see a whole lot of flu. And there are some seasons when that guesstimation was not that accurate. And the strain that actually shows up in the winter is not, the vaccine is not effective towards it. So a person could have taken the vaccine and then also had the flu that year, and they feel that it's because of the vaccine, which is not true. The truth is that the vaccine is a guesstimate, and just taking the vaccine is still not a 100% protection, because they don't know. You have to take the vaccine before the season starts, and only after the season starts do you know which strains are going to be epidemic for that year. So that is the reason for getting the flu. It's not the vaccine itself.
So I guess the next question, as you already kind of addressed it, is why is it important to get the flu vaccine during the COVID-19 pandemic? Do you have anything more to add?
Yeah, I mean, that is something we need to recognize, that when we get the flu, or also when we get the COVID, viruses, by virtue of how they attack our body and affect our body, it decreases our immunity. And so if you get the flu and then you come in contact with someone who has the COVID, your chance of getting a severe COVID infection is much higher. Okay? Not only for people who have comorbidities or other health problems, but even for an ordinary person. Say if I was going to get the flu and I was suffering from it, and on top of that, I got the COVID, my chance of getting complications from the COVID is much higher. So to protect your body from double bummer, basically, it's best to protect yourself from the flu, because at least the vaccine for flu is there. So your immunity won't be down when you get attacked, if you get attacked by the COVID. So it's going to definitely provide protection. And that is the main reason. It's not because if you take the flu vaccine, you'll be protected from corona. Corona vaccine and flu vaccine are totally different. They are totally different viruses. So one doesn't protect from the other, but it does protect your body's immunity, because you don't want to get double infections at the same time. So it's very important for everybody. I mean, we as clinicians, we are required. We are not allowed to work in the hospital unless we have the flu shots. But everybody, even people who used to skip taking the flu vaccine, we would highly recommend this year is to make an effort and please go get your flu shots for yourself and for everybody in your family.
Okay, and I will now give the other panelists time right now to, if they would like to address those questions or add any additional insights.
So I'd just like to add one comment. So I think the reason why that question even arose about whether we should take a flu shot in this COVID pandemic was because when the pandemic started, there was a misconception that somebody will not get infected with two viruses. So there was this misconception that people thought that, oh, if I have the flu, I am not going to get the COVID because the body doesn't host two viruses. But over the last 6-8 months, we have noticed that yes, co-infection is possible. Infection with two viruses at the same time is possible. And then infection with virus and a bacteria is also possible. So like Dr. Sophia Khan rightly pointed, it is very important to take your flu shot in this COVID pandemic, because you can get infected with both the viruses at the same time, and then it will be a double whammy, and then things can just get out of hand.
One point I would like to add also is, anytime you get any vaccine, it is very common to have an immune reaction in your body. So just like, you may have seen children, when they get their vaccinations, they might get fever and they might feel, aches and pains, they might be crying. Similarly, adults also, when you receive a vaccine, your body is triggering an immune reaction. So that way, when you get the disease, it actually is equipped to protect you. So the little bit of, misconception about, some people get the flu vaccine and have these symptoms of fever or chills, they sometimes think that is the flu. That is not. Flu is, really more severe, and, those symptoms that you're experiencing are just a reaction from your immune system. So that is okay. That is not the flu. I'd just like to mention that. And I would like everybody to take the flu vaccine.
Okay, thank you, Dr. Khan, for answering those questions. And now we'll move on to our next panelist, Dr. Asad Kabir, who is in pulmonary medicine.
Assalamu alaikum, everybody. trying to share my screen. I'm having some difficulty sharing my screen, but I think that's okay. I can just proceed without sharing my screen. So I have been given a few topics to address. The first thing which I'll be talking about is how these two viruses spread. The second point I'm going to talk about is how somebody who has the infection can spread the infection. And then the third is how long are we supposed to isolate yourself? Then we're going to talk about people who are high risk of getting complications. And then also we are going to talk about the complications which can happen with both these viruses. So as far as spread of the infection is concerned, so as far as COVID is concerned, there is still some discussion going on as to what is the exact mode of spread for this virus. Initially, there was a lot of talk about this being an airborne virus, and then now there is some discussion of this being a droplet spread. So what is the big difference between droplet spread and airborne spread? To put it in simple terms, the way this virus spreads, or for that matter, flu spreads, is when somebody sneezes, somebody coughs, somebody talks loudly, and droplets come out from their mouth or nose. They can carry the virus, and when somebody inhales those viruses or those particles, and those particles get into their eyes, nose, mouth, it can cause infection and potentially infect that person. So as far as droplet infection is concerned, droplets don't spread very far, whereas when we are talking about airborne spread, essentially it is a kind of droplet, but the droplets are really tiny in this case. They can go to longer distances. So to put it in simple terms, when anybody coughs, sneezes, talks loudly, the virus can spread with particles in that which come out from that person. There is some talk about other modes of spread, like getting it from surfaces. It is possible, say somebody just sneezes on a hard surface and you go and touch that surface and then use the same hand and put it on your face, then yes, you can get the virus in that way. And essentially the spread for flu is also pretty similar to COVID. The next thing I'm going to talk about, which I think is about the infective period of this virus. So CDC has been updating their guidelines about COVID and how long we're supposed to isolate somebody when they have the virus. So sorry, I'm having some technical problems here. So when we are talking about infective period for somebody who has COVID, CDC divides them broadly into three categories: a person who is not immunocompromised, a person who is immunocompromised, and then somebody who just had contact with somebody who had COVID-19. So if you are talking about somebody who is not immunocompromised, say a healthy person, and they develop mild to moderate disease, they can potentially infect somebody even 2 days before they start showing symptoms. And then they can continue to be infective up to, CDC now says, about 10 days from the date the COVID was diagnosed. So if somebody was diagnosed on, say, the 1st of October, they can spread the infection till, they say, about 10th of October. And they also say that up until 3 days from the last day they had fever. In somebody who had severe disease, CDC recommends isolating them for about 20 days. Okay. And the same are the recommendations for somebody who's immunocompromised. They recommend whether they had mild, moderate, or severe disease. They recommend isolating them for about 20 days. So as far as contacts of confirmed cases are concerned, if you have a contact with somebody who has COVID, then it is recommended that you isolate yourself for about 14 days. Talking about flu, flu generally you are infectious when you start manifesting symptoms, and based on CDC guidelines, we generally isolate people for about 7 days after their diagnosis of flu. The next topic I'm going to touch upon is who is at risk of complications from COVID-19. So anybody who has chronic medical conditions, lung disease, kidney disease, heart disease, who's morbidly obese, who has diabetes, who has cancer, who's immunocompromised, all these people are at risk of having complications from COVID. People who are elderly, more than 65, are also at risk of having complications. As far as flu is concerned, the big exception compared to COVID-19 with flu is that children are at a higher risk of having complications, especially kids less than 2 years of age. And then pregnant women are at a higher risk of complication when they get flu. Apart from that, the other risk categories are pretty similar. People who have chronic medical conditions, who are morbidly obese, and who are chronically sick and immunocompromised people. I think the last topic which I have to cover is complications. So as far as complications in COVID-19 are concerned, the biggest complication which we worry about is lung involvement, where people can develop COVID pneumonia, which can morph into bigger problems, where people can end up having really severe disease, end up on a ventilator. So that is the biggest and the most common complication which can happen with COVID-19. There are some other complications which can happen, which include blood clots in the feet, blood clots in the lung. Sometimes people can have strokes and heart attacks because of COVID-19. And then obviously, as we know, it can cause overwhelming infection to a point where people have been dying from COVID-19. Complications of flu are also pretty similar to COVID-19. Pneumonia, real bad pneumonia, where people end up on a ventilator. Flu can also cause cardiac problems, where the heart muscles can get inflamed, the lining of the lung can get inflamed. It can cause brain issues where the lining of the brain can get infected. It can cause serious multi-organ dysfunction and also can cause death. So those are the complications which are expected with COVID and flu. So, if anybody wants to comment, add comments to what I've said, you're welcome to add.
I don't have anything.
Thank you, Dr. Kabir, for your time. And last but not least is Dr. Maniza Ittisham.
Assalamu alaikum, everyone. And I'm going to be talking about the testing updates as well as treatment updates and how things have changed from March up till now. So I'm going to pull up my presentation here. Can you see my presentation? Can you see? Okay.
Yes.
No.
Yeah, we can see it.
All right. So as far as testing for the flu, initially, as you know, back in March and April, we had a lot of difficulty with even testing. We didn't have enough test kits. We didn't have enough labs doing the tests. So alhamdulillah, that has improved. We have many ways to test for flu and for flu we always have had, but for COVID. So I will go over the COVID testing first and then the flu testing next, because the flu testing has always been around for a while. So as far as the different types of COVID tests, we usually can test via nasal swab. And there is antigen tests, there is PCR tests, and then nowadays even the saliva tests are coming out. So the antigen tests are typically what you call the rapid tests, which means that you go to urgent care, they get the test out within an hour or within a few hours. And so it's a relatively quick test. It is a rule-in test, which means that if you're positive, it means that you have COVID. But if it is negative, it means that COVID is not ruled out, because this is not a very specific test. So the rapid antigen test is a rule-in test. And next is the Covet Pcr test, which is a more sensitive test. And this takes a little bit of time. It can take up to 1 to 3 days based on which lab you are using. This is actually detecting the genetic material inside the virus. So it's highly sensitive. And a lot of the hospitals are using this as a confirmatory test. So if the rapid antigen test is negative, then they do the PCR test to make sure. And the patient is still kept isolated till the second test comes back. Self-tests are being used in a lot of places like CVS and Walgreens and all those places where the patient is given the kit, they have to test themselves, and then it goes to the lab. I would not recommend this, since even though we test patients and we know how to test patients and nurses test patients, there is still false negative tests. So although this may sound very convenient, you're not going to go to the right spot and stay there long enough because of the discomfort that is involved. And although this is available, it's not recommended. So please don't use this test if you want a concrete answer. Saliva tests are also coming up. It's not available in a lot of labs. Basically, you spit the saliva and then you send it to the lab for PCR. And then you may have heard about the blood test. This can be done by a finger stick or a blood draw. This is an antibody test. This does not detect active infection because it takes some time for your body to build the antibodies. But it can test positive relatively sooner, and then it can remain in your body for a little bit of time. But this definitely tells you that somebody has been through the corona infection. So this is a good test to know if you have had the infection and you have developed some immunity towards the infection. So these are the different types of COVID tests that are available. And just brushing over the flu tests. Let me just go back up here. The flu test, as you all know, the rapid flu test is again an antigen test. It comes out in 15 minutes. This is a this is also a rule-in test and not a rule-out test. And then there is the molecular assay testing and the PCR testing, which is a little longer and gives you more accurate results. The most accurate is the influenza culture, but by the time you get the culture results, it's already kind of past time for treatment. So typically, if we find a patient with clinical symptoms, as Sophia has mentioned, the common clinical symptoms, if they have those, we even if the test is negative, sometimes we, if we know that the patient may have the disease, we might begin the treatment. And both the influenza and the COVID tests, the diagnosing tests are done through the nasal swab or the pharyngeal swab, or sometimes both are done. So this is about testing for the flu. Testing for the COVID, I already covered. And the treatment for the flu, as you know, has been around. This basically decreases the duration of illness. That's the only advantage of the Tamiflu, which we use. And there's several other medications, ribavirin and amantadine and other medications. Most commonly, we use the Tamiflu. If the patient is detected to have the flu and we find that out in the first 24 to 72 hours, if we begin the Tamiflu, it is going to be helpful in decreasing the course of illness, especially if the patient is prone to complications and problems with the disease. And then other things that that are common are you still, can take your vitamin C, your zinc that helps with immunity. And then one thing is the household contacts who have been exposed to the person can also take the Tamiflu. We don't have anything like that for COVID prophylaxis for household contacts yet. So that's an advantage here with the influenza treatment. And of course, there are other home remedies, saltwater gargles, fluid intake, isolation, all those apply to influenza as well. COVID treatment updates. So compared to March, we have come a long way, alhamdulillah. There are better protocols now as to what medications to give. There is greater availability of the medications. There was a point in time we knew that this medication might help, but we didn't have access to that medication. It was not available in the hospitals, and there was not enough PPE, which is the personal protective equipment for the physicians, for the nurses, for the common public. And so there were a lot of things that we were short, and by the grace of Allah subhanahu wa ta'ala, those have improved. We have better treatment protocols, we have better availability of medications, we have more protective equipment, and basically the treatment protocols depend on the severity of the disease. So if you have contracted COVID and you tested positive and you are feeling relatively okay, meaning that your oxygen levels are, good, it's always a good idea to have a pulse oximeter at home and check your oxygen levels, monitor your fevers. So if you have, mild fevers, oxygen levels are okay, the best thing is you quarantine at home, isolate yourself, and, eat healthy, exercise, use the incentive spirometer. So you're, kind of exercising your lungs, opening them up, helping them breathe better. Walking, if you can do that, if you're not really weak, walking at regular intervals, all these things help keep your lungs in good shape and will help you to recover from this disease. Now, if the oxygen levels are low, then definitely you need to seek help and need to get further evaluation. You may need imaging of the lungs, with a chest X-ray first and maybe a CT. As you know, Dr. Kabir has mentioned about the lung clots, that's very common, and also to see the severity of the pneumonia. So imaging will be helpful. Steroids have been highly recommended now for treatment of COVID, and anybody with oxygen requirements, we start them on dexamethasone, 1 milligram, and this is a 6-day course. And convalescent plasma therapy, this is being used. This is basically getting antibodies from somebody who has contracted the infection, and these antibodies are measured, and once they have enough antibodies in the blood, then that plasma is taken from that recovering person and given to the person who is at, contracted this disease. So plasma therapy has been very helpful in a lot of patients. And then we now have access to remdesivir, which is working well in a lot of patients with oxygen requirements. This is a 5-day course. 2 doses are given on day 1 and then a single dose on rest of the 4 days. It's always good to remember that remdesivir is best given early in the course of the disease, because once you get to the point where your lungs are developing a lot of inflammation, nothing helps. So you want to give this before you get to that point. And then, of course, supportive therapy, based on if they have fever, Tylenol, if they, need any other supportive therapy. And then the other thing is a question that I would like you to know, just like this is, previously we thought that once you get COVID, that's it, we get immunity and we are protected from further COVID infections. And a lot of the data from CDC also was saying that, we have to rely on herd immunity. But new data suggests that there is more than one virus types. And a recent study in Lancet, which is a medical journal, shows that you can be reinfected after you have been infected once and you have had antibodies developed to one strain. So this is very important to know, so you don't let your guard down. Even if you have been infected, even if you have had the disease, you still are at risk. You may be at a little less risk, we don't know that yet, but you still want to follow your mask guidelines. You still want to not let your guard down, okay? So that is very important, and do not rely on getting herd immunity and all that yet. And as you know, COVID vaccine is still in the works. We have phase 3 trials going on. It's not approved yet, so we don't have that available yet. So you've got to take your precautions. And then, like the other panelists have already mentioned, you can get infected with both. If you get the COVID and the flu both together, it's going to be one hell of a ride. So prevention of one definitely can help prevent the other, okay? So prevention is the key. So I would like to encourage each one of you that getting one disease increases your risk for getting the other. So please keep that in mind. And in the Southern Hemisphere, the countries that have passed through their winter, we have learned a few things, like Australia, New Zealand. They have already gone through their winter, they've gone through their flu season. So the data there should suggest that they had a very mild flu season. And why was this? This was because they took good infection control measures and prevention measures, and the vaccination rates in these countries were really high. They had 80 to 90% vaccination rates. So we all have to rely on each other to help each other. We all have to get vaccinated, and maybe we can also have a very mild flu season. And wearing your mask, keeping your distance is going to prevent you from the flu as well as from the COVID. So we have to learn this from the Southern Hemisphere where they have passed their winter, and kind of try to implement the same things over here. And flu vaccine, as everybody knows, if you don't like to take the shot and you're relatively good immunity, you can even take the flu mist, which is just like a nasal spray in your nose. So definitely get your flu shot, flu mist, whatever you want. Wear your mask whenever you're out of the house. Keep distance from people. Good hand hygiene. Wash your hands frequently. Use hand sanitizer. Keep your distance 6 to 10 feet from people and stay away from gatherings. When you come home from work or from grocery, anywhere, change your clothes, take a shower and laundry, regularly. These are some of the things that we ourselves are following every day. So want to make sure you do the same. And then, prevent yourself from getting the disease. So just like to summarize here, we do have better testing now. We have more PPE, we have better treatment protocols, less mortality and morbidity, meaning less people dying and less people getting sick, but we still have cases where people are getting very sick. Cases are on the rise still, both in Kansas and Missouri, but more so on the Missouri side right now. It is exploding. St. Luke's has about 100 cases. Research has, I think, more than 80 cases. St. Joe's, where Dr. Kabir is there, is flooding with those cases. So continue to be vigilant. Take your precautions. Take your flu shot. And then, when the COVID vaccine comes, that could be something that you can look into too. So that's all for now. Stay safe. And we all have to fight this together. And I'll give the mic over to Bushra.
Thank you, Dr. Tisham, for your presentation. I would like the other panelists, if they would like to respond to her presentation, you have the floor.
I would like to add a couple of things. One thing is, it's very interesting for us to understand the severity of why we are always afraid of flu every year. So according to the CDC, last year, this is the last flu season in America, 39 to 56 million people had the flu. 18 to 26 people went to the doctor's offices to get treated for the flu. This is 18 to 26 million in America. 410,000 to 740,000 people were hospitalized just because of the flu. And they think that at least 24 to 62,000, that's an average estimate of how many people actually died of the flu last year. So this is why when we talk about flu in the winter season and why is it important for us this year also. One good thing is flu also because it spreads from droplet, and this year we are being very careful. We're not having any parties. We're not going to big congregations or sport games. That is also one of the reasons, because we're trying to protect ourselves from COVID. Hopefully we will have a mild flu season because we're not socializing. And when you socialize with people with the flu is when you get the flu also. So that might be a good thing. One other thing I wanted to point out is, working in a regional COVID referral center where my hospital and our team, we take care of patients from 15 to 20 different hospitals. People have to remember and also encourage their family members and friends, if they ever find out someone has the COVID, please keep a close eye on yourself. First few days, like, you might not feel too bad. It's when the virus builds up in your body is when the risk of you suddenly crashing happens. So keep a very close eye. If you have a pulse ox, it's most of my Johnson County patients, that come from Menorah and Overland Park that have the pulse ox. Most of the people who don't have that kind of money are unable to afford having a pulse ox at home. And so it's very important to recognize that when you start feeling short of breath, like even going to the bathroom, you feel like you have to huff and puff, and you feel like it's an effort to breathe, that means your oxygen level is probably dropping. There's no harm in quickly getting checked. And the reason I say that is, like Maniza mentioned, the window for you to get treated where the treatment is actually effective and can reverse the disease before it goes to a level where there's really no cure is within 2 days. If you don't get to us when the oxygen level is dropping and the symptoms start, when the day from the symptoms started within the 4 or 5 days, you're out of the window for benefiting from remdesivir, which does help. And so it's very important to recognize, no, don't let people be stubborn and say, oh no, it's just the flu, I'm going to get better. If they come to our ERs or our hospitals when they're already in respiratory failure and they immediately end up on the ventilators, at that point, really none of the medicine does anything. We try the plasma, we try the steroid, and they just linger on and on and on for weeks. So early recognition and early medical care is key in so far what we have as far as treatment is available for coronavirus. So it's very important to recognize this and encourage friends, family members, whoever has it, to please watch out for those symptoms and then get treated right away. I just wanted to make sure I mentioned that. Thank you.
Dr. Kabir, would you like to say anything?
No, I think Dr. Sophia Khan addressed what I was going to comment. Yeah, good to seek medical attention early and keep a close tab on your oxygen levels. I think that is very important. If your oxygen levels are dropping, then yes, you should seek medical attention, especially if your oxygen levels are going below 94%.
Okay, so now we're going to go through some of the questions in our chat box. The first is, can we check oxygen level at home? What are the options or equipment that's available for non-medical persons? So I'm guessing this is like a recommendation. Do you guys have any recommendations for equipment that you would?
Yeah, so these are very easily available. They're called the pulse oximeters. I think I've heard from patients they're about $100. I don't know. I don't have one myself.
I think they are cheaper than that. I think they cost about $30, $40. $30
or $40.
Yeah,
okay.
they're pretty
I'm
cheap.
sure they might be more easily available now. When the COVID epidemic started, they were very hard to find, but I'm sure more companies made them. Amazon might be selling them too. Pulse oximeter is what it's called. It's just a little thing you put on your finger. It's like a clip, and it tells you your oxygen level.
Okay, so the next question is, older people have a higher risk of complications. I am wondering, what treatment did President Trump get that he recovered so fast and so active afterwards? Why doesn't everyone get the same treatment?
So he received the synthetic antibodies. So I talked about the plasma therapy, where you receive convalescent plasma from somebody who has already suffered coronavirus. So they measure the antibodies in the person's blood, and then they collect antibodies if they have sufficient antibodies, and then they transfuse this to the patient. So this is actually from human subjects. So there are limitations in the fact that, some people may produce good antibodies, and, they may be producing antibodies to one kind of strain. So there are limitations in the convalescent plasma. What Trump received is synthetic antibodies, that's in phase 3 trials. It's not available to us yet because it's not FDA approved. But it's a clinical medication. And of course, he's the leader of the country, so he has access to that. We don't. So basically they have manufactured some antibodies to the different strains of coronavirus that we know exist. And those synthetic antibodies is what he received. So we don't have those manufactured in bulk yet. So we don't have access to that yet.
Yeah. They have applied for emergency FDA approval, but yeah, they have still not gotten FDA approval. So we still don't have it available for everybody's use.
That's VIP treatment.
So we have a comment in our chat box, and somebody has mentioned that Missouri does not have a mask mandate. So basically, if everyone voted, this could dictate how future planning for COVID, basically. So it kind of highlights the importance of everyone getting out and voting. Do your duty. Has also mentioned in the comment section that you could get an oximeter on Amazon for as low as $25. Another person has said, is it safe for our parents to go and travel back home, meaning out of country?
Oh, please don't. Don't even try it. We're having a big fight in our house as my mom is starting to make plans for next year and we're not ready to let her go. No way. If you love your parents and if they're safe here, tell them to stay put. You know, my mom lives in California. I have not seen her since the crisis started. Just because I don't want to travel and take anything to her. She's obviously locked up in the house in a bubble. But if you love your parents, don't even travel from here to go and see them. If you do, then you need to quarantine for 2 weeks and get tested. Make sure you're negative before you hug your parents or you get close to them. So I would strongly urge all of you, please let your parents stay put and lock them up in the houses. Do not let them travel, okay? Please don't do that.
I think, one thing you need to remember is plane does not have any ventilation and there is the same air circulating. Everybody is breathing the same air. So that's another bigger risk factor in addition to traveling, like Sophia said. Basically you're traveling and breathing the same air that somebody else who might be in the plane and sick. And, I know they're doing the tests and everything now before you board the flight, but, there's still a window where you may not be detecting the disease on the test and you can still be exposed. So yeah, definitely not recommended right now. The best way to travel is as far as you can go in your own car.
And it's not just the airplane. You have to remember the airport and the interaction, the multiple interaction you're going to have with other people. I have personally treated many patients who took airplane trips for their work. They have to travel and they got the coronavirus from there. So it's definitely the cases from airplane are there.
True.
Okay, so the next question is, if I am exposed to COVID positive person, I still need to quarantine even if I don't have any symptoms?
So I can take that question. So what is exposure? Exposure is defined as being in close proximity to somebody who was diagnosed with COVID, and close proximity is defined as being within 6 feet and being exposed to that person for about 10 to 15 minutes. That is what is defined as exposure. And if, yes, you have been exposed to somebody who is COVID positive, then even if you don't have symptoms, it is recommended that you quarantine yourself for 14 days. And if you start having symptoms, then you need to quarantine yourself for 10 days from the day you get diagnosed with COVID, and you are fever-free for at least 3 days.
I would just like to add in response to that question that there have been some studies done to look at the infectivity of the people, whether they have symptoms or whether they don't have symptoms. The infectivity is just the same. So you could have no symptoms and you could be spreading the disease with the same number of viruses coming out when you talk and, similar to a person who is sick with the disease. So just because you don't have symptoms and you have been exposed, it doesn't mean you cannot spread the virus. So, just so we are aware of that. The infectivity is the same, for the people without symptoms and with symptoms.
Okay, so I don't see any other questions. Do any of the panelists have anything to add to our talk before we end?
Yeah, I would like to mention one thing, and this is definitely, I'm feeling it, and I have sympathy for all of us. There is some pandemic fatigue. You know, all of us are getting fed up of this, you know. It's very hard for me to think, like, pause myself for 5 minutes before entering the patients who have COVID, and make sure I'm not thinking of anything, not answering any pages, and just focusing on gowning up properly. You know, I'm getting fed up of it, you know. I'm just getting fed up of coming out and spending 15 minutes cleaning myself after that patient, making sure I'm taking each glove off separately. So people who are at home and are not even getting to see the sick people, who have not really seen the real devastation of this disease, we are actually seeing it every day, can feel like, why is it? I'm fed up of being at home. I want to go out. I want to go meet my friends. I want to go spend time. I want to go to the restaurant. I want to go to the movies. It's unfortunate, you know, it's just unfortunate what the situation is. And we cannot let this pandemic fatigue make us do one mistake is all it takes, you know. You go and see a friend or go to a party, 10 people in the room and don't wear masks, and boom, you got it, and you bring it home and you give it to your family members. If the death rate is 3%, that means every 100 people who are getting it, and that's what in people who are 18 to 34 years old, you know, the death rate is 2.7%. That means every 100 people that get it, 3 of them are going to die. It's a huge number for 18 to 34-year-old out of 100. If 2.7% people or 3 people are dying, that's a big number. You know, the virus is not relenting. Let me tell you that. Yeah, we are recognizing it earlier. The death rate has gone down because we have slightly better treatment. We don't put people on ventilators like we used to. And I think ventilators were causing a bunch of the problem and death. Now we're recognizing we have more testing available. So there are many reasons why the death rate in general has gone down, but the virus is as deadly and as serious as it was before. So there is no reason to believe that anything is safer outside than it was since March, or actually since February, when this virus was already among us. So please stay put, you know, no matter how frustrated you get, don't start inviting people or having secret 20 people. And I would love to go to everybody's house. And I was just thinking about it. I miss those dinners. I miss those conversations with my friends. You know, it's nice to be around your spouse and your kids, but, you know, you need your friends. You need a free time to just chit chat about nothing. But unfortunately, don't let this pandemic fatigue get the best of you. Especially, we were doing a lot of outdoor stuff with our family. We were doing gardening, we were walking and, you know, exercising and all. And now that winter starts, we'll be really locked up inside our houses, and it's going to get even worse. So let's mentally be ready and encourage each other to stay put and take advantage of Zoom meetings with our family and friends. Maybe be more creative and not let this, not let this pandemic fatigue make us do stupid things that we will regret later, inshallah. So if there are no other questions, I would like to make a short dua.
There's one more question.
Comments?
There's one more question. It said, after you had COVID-19, how long do you quarantine from everyone else, especially if your test has come up negative?
Asad, do you want to answer that?
Yes. So we don't have to have a negative test after you are diagnosed with COVID for you to get out of isolation, because we have had data where people can test positive for a month, sometimes 6 weeks, sometimes even longer. So you don't need a negative test to come out of isolation, but based on the updated CDC guidelines, so you have to quarantine yourself for 10 days after the day you were diagnosed, and you have to be fever-free for at least 72 hours. So this is for somebody who has a normal immune system. If you don't have a normal immune system, if you have medical issues which make you immunocompromised, then CDC recommends that you isolate yourself for 20 days after the day you were diagnosed and being fever-free for 3 days.
I would like to just mention one more thing. As Sophia was saying about the gatherings, I had a patient that came from a mask wedding which had people about, I think they had about 50 people. They all wore masks and everything. And unfortunately, there was somebody there who was positive, and my patient got infected, but they got calls from the bride's mother saying that every one of the 50 people tested positive after that wedding.
Oh,
So basically, they were all wearing masks. They were keeping distance. The only time they took off their masks was when they were eating. So don't know where they got infected, but each one of those 50 people tested positive. Some got, bad disease, some didn't. And my patient, luckily, didn't get that bad disease, survived, doing better now. But just to let you know, even if these are people people from your own family that have not been around other people, we don't know how they have gotten exposed. So when you're mixing, even though there are 50 people that you know and trust, you can still get infected. So just to, keep up your guard.
I think they got infected when they took their masks off and had dinner.
Yes.
exactly. I was about to say that, they were probably chit-chatting and talking at the same time. That's all it takes. Like Asad said,
Just
10
keep-
minutes of this unmasked exposure, 10 minutes is all it takes.
Even in the hospitals, the biggest cause of spread of COVID-19 amongst healthcare providers is not when they are taking care of patients, it's when they are taking a break, eating together with a coworker without a mask.
Yes. So actually in our hospital, the nurses and everybody in their break rooms, they have been asked to either eat one at a time or, eat in different places, not together in the break rooms.
Okay, so I don't see any new questions coming up right now. So on behalf of the Women's Committee, I would like to thank everyone for joining us this evening and your continued support of ICJC. Please stay with us for more future talks. And I would like to hand it over to Dr. Sophia Khan right now for a short dua.
Okay, this is going to be nothing formal, but it's Maghrib. I know all of us are going to break and then go and pray Maghrib, inshallah. So let's all pray together that may Allah protect all of us. May Allah protect our family, our friends, our relatives, our co-workers, people who are putting their lives on the line, the frontline workers, whether they're grocery store workers or whether they are the policemen who are going to people's houses, or firefighters or doctors or nurses, or even the cleaning crew in our hospitals. Everyone who is working to take care of these patients, and everyone who's at home trying to stay safe, our parents. May Allah protect all of us during this upcoming winter season. May Allah protect all of us from all kind of shar and all kind of things that can harm us, and keep us in His mercy. And thank you. And please remember us in your duas, and I will for sure make dua for all of you. Thank you. Jazakallah khair. Ameen.
Ameen. All right, I think we are ending this. So I think Rifat is gone. Assalamu alaikum, everybody. We will leave now. Jazakallah for attending. And thank you, Sophia. Thank you, Asad.